are live! Yay! Happy Friday! Okay, I really don't like wearing t-shirts. However, this t-shirt speaks to me right now. Yeah, okay. I don't like wearing t-shirts. I'm not a fan of t-shirts, but I always buy t-shirts. I like talking shirts. So I miss doing crazy hat day, your favorite team shirt day. I think we should start doing that again, just to spice it up a little bit. Okay. Today is Friday. Yay, Friday. And I have a lot of meetings after this class. So I am targeting to finish at 11:30 your presentations, okay? There will be no labs on Monday for you guys because we will do a live Zoom review for final exam on Monday, okay? Is that clear? You don't have to go to the campus on Monday, okay? We will do a live Zoom for our final exams on Tuesday. So schedule this coming week. Monday is going to be live Zoom review for pharmacy tech duties, PHA 108 final exam. Tuesday is final exam. Okay. We've finished all of our prescriptions, so I should be recording letter and number grade for you guys. I don't want to record any incompletes. Okay. Also, Ms. Trisha, I have a team meeting, pharmacy instructors today at 2 p.m. I have a staff meeting at 12 o'clock, so I'm targeting to finish at 11:30, so that I can have like 30 minutes breather and I can prepare my son's lunch during that time. But as for Wednesday labs, I am going to make an announcement on that one, depending on how Ms. Trisha is, how she's healing, how she's recovering, what are her physical restrictions. What are her restrictions physically? If she can only do online, she's still going to be wearing her neck brace, but I don't know her physical capacity and restrictions at this point. Okay, so today will be a good the meeting today will be ironing all those things out. Okay, she'll definitely start at the night in the night class starting April 21st. Okay, she will be the official night instructor starting April 21st. Okay, but of course she's still going to be helping us with labs. Okay, anyway, who wants to go first? We are going to do the review of the top 200 drugs. I saw Kevin go first. Everybody's in a hurry. I love it. Okay, so Kevin first, and then I saw Nicole go next, and then Robert next. So those are the first three that raised their hands. We are going to still do the review of the top 200 drugs. These are still included in your top 200 drugs, though we're focusing more on the three systems because our pharmacology, the sequence would include the systems, cardiovascular, respiratory, and your digestive or your gastrointestinal system. Let's start, Kevs. Take it away.
All righty. Good morning, guys. So my drug for this week is Lovastatin. Brands are common brands. Brand names for this medication are Mevacor and Altoprev. System cardiovascular. So it's one of the ones that are, we're learning for this week. One of the systems. Uses. This is for the high cholesterol, triglyceride levels. So, and it also aids in the chance of reducing a heart attack, a stroke, or having blood vessel problems. Therapeutic class, it's a lipid lowering agent, statins. Pharmacology class, it's HMG hyphen CoA reductase inhibitors. And what is HMG? This is basically just say it's a statin. They're a class of lipid lowering medications. They reduce illness and mortality in those who are at high risk of cardiovascular disease. And they're common for medications that are also for lowering cholesterol. Side effects, elevated CPK. What is CPK? Creatine phosphokinase. It's an enzyme in your body. It's found in your heart, your brain, and your skeletal muscle. So it can elevate those levels. And often means that something is going wrong in those areas affected from taking this medication. Also flatulence. I'm sure everyone knows what that means. Abdominal pain. Administration, we got extended release, and then there's regular tablets. I have examples here for on screen on the slide for the regular 10 milligrams, and then the extended release 40 milligrams. Pregnancy category is X. Basically, it is not recommended at all because it can lead to the lactation of this medication into the baby. So it's definitely not something you want your baby to have, and it's only a RX only, so only by prescription. Okay. Some other useful information I found was it's the so like I said, CPK. It's just basically it gets elevated when something's going wrong with the heart, the brain, or skeletal muscles due to injury or stress, or because of something that's in the bloodstream. In this case, the medication. Some common things are, of course, don't take this with alcohol. So just keep that in mind. And that's pretty much it.
Don't bring it down yet. Okay, important information. So popular brands, Mevacor, Altoprev. The generic is Lovastatin. This is a common suffix. Do you realize? Statin. What are statins? Sometimes they call it a class now, the statin class, but it's not a statin class, okay? It is actually what? Simvastatin, Atorvastatin, Lovastatin. What group is that? Don't tell me statin. Anti-hyperlipidemic. Anti, let's break it down. Anti means against. Hyper means high. Lipid, cholesterol. Emia, in the blood. So what does this do? Statins in general, okay, lower
Cholesterol?
cholesterol. Very good. Layman's term. I want to simplify things, okay? So it is very common to see, though, hint, hint, wink, wink, comes up on the PTCE most of the time. The pharmacological class is the HMG coenzyme A reductase inhibitor. You will see this, very common, so might as well remember it. HMG and then coenzyme A reductase inhibitor. Once you see that as a class or a pharmacological class, to be more specific, okay, that is for cholesterol, okay? And the term therapeutic class may be anti-hyperlipidemic for hyperlipidemia. Hyper is high, lipid pertains to cholesterol, emia is in the blood. Are you following? Yeah, okay. So if you see on Kevin's slide, it says therapeutic class, lipid lowering agent, because it lowers right there. He's using his cursor, okay? And then nowadays, people call it as statins, okay? But statin is a suffix that is on the book that I gave you, top 200 drugs, memorizing made ridiculously simple or easy, okay? Statin is one of those common codes. I call it a cheat code, right? Or common suffix. So if you look towards the letter S, you will see Lovastatin in there. Statin, Lovastatin, Simvastatin, okay? Atorvastatin. These are all lipid lowering agents or anti-hyperlipidemics. And you follow? I'm giving you so many different medical terms, okay? Important information to pregnancy category is X. Kevin, what is X?
X means it's contraindicated with pregnancy. This and if you are pregnant, discontinue. Don't use that at all. And if it can pass through the breast milk of the nursing mother, so you don't want to give it to the offspring.
Yeah, X may cause severe birth defect to death. Okay, so X. We have A, B, C, D, and X. A is safe. X is do not give to. pregnant women. Kevin said everybody knows what flatulence is. Flatulence is gas, okay? In case you don't know, okay? So thanks, Kevin. I think I said Nicole will go next, and Robert. Just by the way, I got your slide. However, I still would like you to try real quick. If it doesn't go right away, then I'll show the slide, okay?
Okay, thank you.
Mm-hmm. You're welcome.
Okay, so mine is Lopid. The generic is Gemfibrozil. And then the therapeutic class is fibric acids, and it pretty much lowers blood triglyceride. Pharmacology
Because your
class.
lipid, your triglyceride, all has something to do with cholesterol.
The pharmacology class is valeric acid, and then the pregnancy class is class C. But the doctors don't recommend it just because it could get into the breast milk too and mess with the baby. So you would want to consult a doctor on that. The DEA class is prescription only, so you'd have to get a prescription from the doctor. The side effects include the upset stomach, any type of stomach pain, nausea, vomiting, diarrhea, constipation, rash, and dizziness. It helps lower fats and raises better cholesterol in the blood, and it works by decreasing the amount of fat produced by the liver. Info used to lower risk of stroke, heart attack, and other high cholesterol. Also, you should call the doctor right away if you have unexplained muscle pains, tenderness, or weakness, especially if you have a fever, unusual tiredness, and the color of your urine has changed. You should avoid eating foods that are high in fat and cholesterol because it's pretty much going against it. And then you should also avoid drinking excessive amounts of alcohol because it can increase the risk of liver problems. The doctors say that Lopid shouldn't be used if they have severe liver disease, severe kidney disease, gallbladder disease, and you should also inform them if you had gallstones. But there's also an easier way to remember Lopids too. Since it's like used for lowering fat and cholesterol, there's a word for fat called lipid. And if you remember lipid, then you can correlate it to Lopid.
Very good. I like that. Lopid, lowering the lipid levels. So look at the class right there. Actually, it's on the box of Pfizer's Lopid. Look, anti-hyperlipidemia. Anti is against, hyper is high, lipid. Once you hear lipid or triglyceride, the first thing that should come to mind is cholesterol. Emia is in the blood. Okay, so lopid, lower the lipid. Okay, let me talk about good cholesterol and bad cholesterol first. Okay, let's check if you know. LDL, low density lipoprotein. HDL, high density lipoprotein. Which one is good cholesterol? Which one is bad cholesterol?
Isn't it? Hold on.
Tricky. It's tricky.
Yes, this is very tricky. Hold on, I got this.
I hope Mr. Jackson taught you this.
The L D. Okay, from your face, it's definitely saying H. We're going for the H. Yeah.
HDL's the good. LDL's the bad.
Yeah, Kevin
My
said.
face don't lie. Yeah, is that how it is? It was like,
pretty much, yes.
I was about to tell Nicole every time she logs in, she always looks fresh, like she's freshly showered. So anyway, she said my face doesn't lie. So For the cholesterol part, you usually like the low, right? Low fat, low, everything. This is what you remember with cholesterol. The good cholesterol is the HDL, the high density lipoprotein. So if you go for your blood work and you're looking at the results, you want your HDL to be high and your LDL to be low. It's the opposite when it comes to cholesterol, okay? Good job, Nicole. Gemfibrozil. Good. Next one, Robert. I saw the first three raise their hand, so I'm doing it this way, and then we'll see who goes next. Who wants to go next? Adziri will go next, and then let's try to finish at 11:30. Okay.
Okie dokie. Okay. Present. Haha. Okay. I got Lopressor. And, if you're thinking to yourself, that sounds a little familiar, because the first set of drugs we did when you newbies came by, Lopressor was like the first one we did. So, yeah. Anyways, the generic, Metoprolol. But I'm sure you know that because Miss L quizzed you on that. Therapeutic, it's a beta blocker. The pharmacological, it's an anti-anginal agent, anti-hypertensive, and a beta blocker. Pregnancy category is C, so you probably shouldn't give it or take this if you're pregnant because it can get in the breast milk. The DAA class, it's a RX only. Adverse effects, you could get dizziness, headaches, not some fun stuff. And then for the dosages, it comes in 25, 50, and 100 milligrams in tablets. It's used to treat or for long-term treatment for angina. It treats hypertension and it treats myocardial infarction. And some extra info, you should not crush these pills or tablets or alter them in any way whatsoever. Patients with bronchospastic disease should avoid taking this. I think it's because it said it was a beta blocker. That's why they shouldn't take it. I think that's what it said in my book. And people with diabetes should probably not take this either because it can mask hypoglycemic symptoms. And that's all I have.
Okay. Is Lopressor a brand or a generic? It's a brand.
Lopressor is the brand.
Okay, so the brand, some sort of a giveaway too, like low PID, low pressure, low pressor, right? Okay. The generic is one of those in the cheat codes in the book that I gave you. Okay. So generic is the Metoprolol. Olol. Once you hear the suffix olol, remember the cheat codes that I gave you, the book that I gave you, top 200 drugs made ridiculously easy to memorize. The cheat codes I said in there, the suffixes, prefixes, and roots only work for generic. So let's look at the generic, Metoprolol, olol. Once you hear the suffix olol, the first thing that should come to mind is beta blocker. That's your pharmacological class. Once you hear beta blocker, the therapeutic class should be antihypertensive for hypertension. That's how you don't have to memorize these drugs. That's how you can start knowing them by heart, okay? And then knowing what they are for. Once you know these cheat codes, once you know and you've really taken that book that I gave you seriously, I actually didn't let you pay. I think they're selling it on Amazon for $10. I gave it to you for free. My original manuscript. Use it. That's all I ask from you. Use it. Okay? So next time I'm going to charge you. Because if you pay for it, you value it. If you don't pay for it, you don't value it. Okay? So value it. I give it to you because you're my students. Okay? So I give it to you for free. Use it. Olol is in there, just like statin is in there. Okay? Olol, beta blocker. Generic Metoprolol. So look at the therapeutic class, antihypertensive right there, okay? But also Metoprolol is also used for angina, okay, which is chest pain. Those are the important things that you want to look at because these drugs, you can group them, yeah? Either by therapeutic class or by their suffix. The suffix is a giveaway of what they are. The suffix is, if you know the suffix, those common roots, prefixes, and suffix, if you know them, then you can tell what the therapeutic class is, which the therapeutic class is the medical term for its use. Yeah, look, beta blocker, metoprolol, olol, beta blocker, you flip-flop this. This is the pharmacological class, beta blocker. Therapeutic class would be antihypertensive. Okay, I've seen a meme. It's a little bit cheesy, but it says in there, olol, okay, makes your patient go LOL because they don't have hypertension anymore. I try not to use those cheesy stuff, but I know, makes your patient LOL because they don't have hypertension anymore. Sounds
I
okay.
feel like that's gonna help me remember it, and I hate
Really?
Same here. Yeah.
it.
So I said in my audio lectures, and I always tell you guys, right? Funny sticks in the head. Funny sticks in the head. If you speak a different language like Spanish, it helps you out too, especially with the medical terms and the drugs. Okay. But funny sticks in the head. There are a lot of things that happened while I was in pharmacy school, but it's the funny ones that I cannot forget. Okay. Stories stick in the head. So how cheesy it may be, LOL. Okay. OLOL. Makes your patient go LOL because they don't have hypertension anymore. Maybe. Okay, well, that's just something I saw. It's not originally Miss L. Thanks, Robert. Adziri is next.
Okay, so my drug was Lansoprazole. That is the generic name for Prevacid. Prevacid.
Prevacid.
What was it?
Prevacid.
Prevacid. Okay, yeah. And the pharmacological class is the proton pump inhibitors. A therapeutic class was GERD, which is I can't pronounce that word. Gastroesophageal reflux disease.
You
Yeah,
got it.
that's it.
Very close. Yeah. So GERD,
Okay.
gastroesophageal reflux disease. Gastro is stomach, and then esophagus.
Yeah. So then it's used to reduce the acid in the stomach and also like for heartburn and stuff. The DEA class, it's not controlled. It's prescription or over the counter, which is like this one that I put here. The pregnancy class would be B. And then some side effects or warnings would be can cause like some kidney problems, diarrhea, constipation, headaches, dizziness, and all that. I also read something about that it can increase or give new signs of lupus, which is another disease. And yeah, that's all I have.
Miss L, you're on mute.
Don't take it down yet, Adziri.
Okay.
Here is another common suffix. Prazole. Prazole. Not azole, not a hole. Prazole. Okay? When you hear prazole, the first thing that should come to mind is PPI. Proton pump inhibitors. Okay? I'm going to simplify this in layman's term. And I always wish my pharmacology professor explained it this way. Okay, so our stomach, I wish I'm taller, our stomach has little pumps in there, okay, that continue to pump. Okay, when they pump, they secrete acid, which is hydrochloric acid. That helps with digestion. Okay, some people produce so much acid. Okay, so much acid. That's why there's hyperacidity. Okay, bless you. So much acid. Okay. Produces so much acid. It doesn't stop pumping, right? Okay. That's why they have hyperacidity. Okay. Proton pump inhibitors slows down or inhibits the production, the overproduction of this acid. Okay. So what is GERD? So it starts off with hyperacidity, right? Okay. Like I got sour stomach, okay, because you produce too much acid in your stomach. But sometimes it's even worse. Okay. The hyperacidity is worse that you regurgitate. The contents of your stomach goes back up and you hear people say, I throw up in my mouth. Okay, usually happens at the middle of the night, in their sleep, and triggered by the food they ate during dinner. Acidic food, tomatoes, spaghetti, okay? So tomato sauce-based food, okay? Anything acidic, okay? So GERD, the term GERD is gastro, meaning stomach, esophageal, reflux disease. So the contents of the stomach go back up to the esophagus. That's why you hear people say, I throw up in my mouth. And that's GERD, okay? Because the acid is too much, it pushes the food out, or it pushes the acid out back into your mouth, GERD. Common suffix is prazole. Common suffix is prazole. When you hear prazole, it's a proton pump inhibitor. Let me just show you something if I could. Okay. Thanks, Ziri. Reduce acid in stomach. Okay, let me try to share my screen. Oops, it's not showing. I gotta rename it, I guess. Done. I gotta find it in my desktop screenshot. Recent. Because I just screenshotted it. The prazole is also in the common suffix, just so you know, okay? It's also in the common suffix. So when you hear prazole, omeprazole, lansoprazole, pantoprazole, PPI, proton pump inhibitor. Where did it go? Hang on 1 second. Let me. Here we go. Okay, I wish I could show you bigger, but my picture is too. Oh, there you go. This you will remember. Yeah, this visual you will not forget. This is how multiple choice question is when I took my pharmacy board. Pharmaceutical multiple choice question be like omeprazole, esomeprazole, and lansoprazole. Aren't they the same person? Yeah? Okay. My point is that suffix prazole can tell you so many things. That suffix prazole is a PPI, a proton pump inhibitor that is used to reduce stomach acid, right? Okay, so here's what's happened, reality. Patient is given before esomeprazole, which is Nexium, doesn't have a generic available. So it's very expensive, okay? And the insurance, when the patient comes, like, oh, your insurance doesn't cover Nexium, okay? So what do? We call the doctor to replace it with lansoprazole or omeprazole, okay? Because that's what the insurance will pay for or will cover. Do you want a multiple choice question like this? Okay, bottom line, my point is prazole is a common suffix. Use the book I gave you, okay?
So,
Yeah?
how did you get that picture of me that was on the right?
I love you guys. You make my Friday even more better. Okay, so I'm a little bit foggy today because I'm doing the water fast the next 72 hours. No coffee, no supplements for the next 48 hours. And then on my day 3, I am going to do my supplements, but just water all day. So I weighed last night. I needed to detox. I don't know if I can exercise the next 3 days, but I know I'm gonna feel weak. So I'll tell you about it later once I'm finished with it. And yeah, of course there are warnings. Diabetics cannot do the water fast and stuff like that. So Prazole, take note. I talked about statin, I talked about Olol, I talked about Prazole, Lansoprazole. What's the brand name at Ziri again that's popular?
Prevacid.
Prevacid. Okay, that is Lansoprazole. Okay, because you're gonna have Omeprazole. Okay, look-alike, sound-alike drugs sometimes come into play too. So you got to know the brand name. Most of the time, here's the thing. I want you to know the most popular brand names. Okay, this was also highlighted by some of my students in the hospital. Okay, they said, Miss L, was like, the nurses call, and when they call, they say the brand name. Yeah, that's why I want you to know the most popular, at least the most popular brand names. And now the PTCB tests you, and the NHA, if you're taking the National Certification Exam, they include brand names in there now. So I tell you the most important ones or the most common ones. That's why I still want you to look for the popular brand names, okay? But if you know the generic, you're golden. And if you know those suffixes, that's the giveaway, you're golden. I kept saying all of these cheat codes, okay? So tell your friends it's available on Amazon. Okay, next one. Who is going? Eileen? Yeah?
Okay, my drug is Maalox. The generic name is aluminum hydroxide, magnesium hydroxide, and simethicone. DEA is OTC. The pregnancy category, I was confused. There was a C and then there was a not assigned, so I wasn't sure which one.
Eileen, let me highlight that it is not a controlled substance, so there is no DEA class. Okay, there's no DEA class. It can be prescription or OTC, and Eileen mentioned that it's OTC. Okay.
Mhm. Okay, so the drug class is antacid combos. Dosage is oral suspension, oral tablet, and chewable. And the uses is relief of acid indigestion, relief of bloating, discomfort, pressure associated with gas, relief of heartburn, relief of sour stomach, relief of upset stomach due to acid indigestion, heartburn, and sour stomach. And then a warning says even though it may be rare, some people may have very bad and sometimes deadly side effects when taking a drug. Tell your doctor, get medical help right away if you have any of the following signs or symptoms that may be related to a very bad side effect. Signs of allergic reaction like rash, hives, itching, red, swollen, blistered, or peeling skin, with or without fever, wheezing, tightness in the chest or throat, trouble breathing, swallowing or taking unusual hoarseness or swallowing of the mouth, swelling of the mouth, face, lips, tongue, or throat. And then I also got there was the FDA alert for some of the Maalox products, which is the Maalox Total Relief. It says it's not appropriate for individuals who want to use antacid since it contains the active ingredient bismuth subsalicylate, salicylate, I cannot say it, which is chemically related to aspirin and may cause serious adverse effects such as bleeding. Maalox Total Relief should not be used in people who have a history of gastrointestinal ulcers or bleeding disorder. Then it says it also should not be taken by children and teens if they are recovering from a viral infection, nor individuals who are taking certain medications, including oral anti-diabetic drugs, anticoagulation thinning the blood, drugs as warfarin, Coumadin, and clopidogrel, Plavix, non-steroidal anti-inflammatory drugs, NSAIDs, and other inflammatory drugs. So that's what I got.
Okay. So another one that's an antacid, but this one, Maalox is the brand, the popular brand. The generic is a combination. Aluminum hydroxide, magnesium hydroxide, and simethicone, okay? So it's not only as an antacid, doesn't only work as an antacid, it also works for what did you say? Acid indigestion, okay? Bloating, discomfort, pressure associated with gas, heartburn, okay? Heartburn, I want to highlight that. Heartburn is not a disease of the heart, okay? Many people think that heartburn is a disease of the heart. So a chest pain has to be identified whether it's caused by, whether it is angina or it may be heartburn. What is heartburn? The acid comes up, okay, and then stops right here on the chest. And it hurts your chest. That's why it's called heartburn, okay? It's not a heart problem. It's a digestive problem. Okay, it is the acid getting pushed back up and then it stops right here on the chest that it hurts your chest. Okay, that's why when a patient is taken to the hospital for chest pain, they check whether that's heart related or what, digestive system related, maybe heartburn. Okay, so sometimes a person thought that she's having a heart attack and was rushed in the hospital, and then this happened many times to me, not personally, but a family member would say, I was given an antacid. They came home and so disappointed, given an antacid after the chest pain. And I was like, you should be happy. Yeah, because it's not a heart attack. It's not angina because they figured that it was heartburn and not a heart attack. But it can be. It's funny, but it can also be scary for people experiencing it, especially if they cannot tell how it is, right? And especially if they have heart problems. Okay? I want to highlight, take note of this. When you see aluminum-based antacids, or magnesium-based antacids, aluminum hydroxide, magnesium hydroxide. I want you to remember this. Aluminum hydroxide, aluminum usually causes constipation. Okay, take note of this. Magnesium induces diarrhea. So aluminum causes constipation, magnesium induces diarrhea. So they're both in there. So hopefully there's no diarrhea or constipation factor in there. But just so you know, if it's just aluminum hydroxide, that particular antacid will cause constipation. If it's just magnesium, will cause diarrhea. This is why Tums is aluminum based, may cause constipation. Okay, one of the most abused over-the-counter drugs is Tums. Yeah, it says no more than 5 tablets, chewable tablets, right? But people kept chewing it. Okay, because it's so easy. Tastes like candy. Tastes like Smarties. Yeah. Okay. Thanks, Eileen. Tony, you're next.
It says I can't share while another person is sharing.
Oh, Eileen! Take down your slide. She forgot.
Thank you. So can everybody see my slide?
Yeah.
Okay, cool. My drug is Meridia. The generic is sibutramine, but when I looked it up myself, it said also hydrochloride monohydrate. Is it all of it, or is it just sibutramine? But
Usually the hydrochloride is a salt off, but the major active ingredient is sibutramine.
okay, thank you. The DA class, it's a Schedule 4 controlled substance. It's prescription only. The pregnancy class is C. Administration is PO. And the dosages are 5 milligrams, which are blue and yellow. The 10 milligrams are blue and white, and the 15 milligrams are yellow and white capsules. Doses above 15 milligrams a day are not recommended. For storage, it says protect capsules from heat, moisture, dispense in tight, light-resistant containers. And it's used to treat obesity, weight loss, and maintenance of weight loss. May be used alone or in conjunction with other medications. And in conjunction just means with, so yeah. The common side effects are dry mouth, loss of appetite, insomnia, constipation, and headaches. It is not known if it is safe and effective for children under 16, and also for people over 65, I believe, should not be taking this.
Done?
I had some other things. It says, before taking sibutramine, tell your doctor if you have glaucoma, high blood pressure, liver or kidney disease. It says you should not take if you have severe or uncontrolled high blood pressure. That's important. You shouldn't take it.
Good. Okay, so things I want to highlight on Meridia. It's a Schedule 4 controlled substance, DEA. So this is what I'm saying. You just don't take weight loss products, okay? Phentermine turns you positive on drug tests, okay? This is controlled as well. It's a Schedule 4. It's used to treat obesity. It's used for weight loss. It may be used in conjunction with or together with other medications, okay? So we use Meridia, sibutramine, for weight loss, but I'd like to highlight that this is controlled C4, okay? And very important information that Tony mentioned, you should not take this if you have, what's the last thing you said, Tony?
Severe or uncontrolled high blood pressure.
High blood pressure. Okay. I wouldn't take it in general if I have blood pressure problems or hypertension. Okay. Even if it's controlled. Okay. So thanks, Tony. I have Jess's PowerPoint. So if you could just take that down, I will share my screen. Jess, you're going to be the last, right? And then the rest will be from me. Got it?
Yeah.
Okay.
So my drug was Lipitor. The Lipitor would be the brand, and the generic is Atorvastatin. Therapeutic class is anti-hyperlipidemic. Pharmacology class is HMG, CoA reductase inhibitor. The uses, it's used together with a diet to lower bad cholesterol or to increase levels of good cholesterol and to lower triglycerides, which is the fat. It also lowers the risk of stroke, heart attack, or other heart complications in people with type 2 diabetes,
coronary heart disease or other risk factors such as high cholesterol. DEA class is prescription only. The pregnancy category is D, so do not take if you're pregnant or breastfeeding. Additional info I found, it may take up to 2 weeks before your cholesterol levels improve. Lipitor is only part of a complete treatment program that may also include a diet, exercise, and weight control. Avoid eating foods that are high in fat and cholesterol. The medication will not be as effective. And avoid drinking more than 1 liter of grapefruit juice per day while taking this medication. It may increase your risk of muscle injury and could result in kidney problems. Also store at room temperature away from moisture, heat, and light. And you must be at least 10 years old to use the medication.
I want to point out a couple of things. First, again, let me highlight, this is not classified by the DEA. It's not controlled. However, just put it in there as prescription because it's only prescription only. Okay. Who presented Lovastatin? Kevin, was it you? Lovastatin? Yeah?
Yes, ma'am.
Okay. I want to point out the common denominators, okay? Lovastatin, Atorvastatin, HMG coenzyme reductase inhibitor. You see that? Statins are HMG coenzyme reductase inhibitor. And statins, what's its use? Are anti-hyperlipidemic. And what's common again? Right here, statin. You see? It's just like the picture I showed you on Omeprazole. Omeprazole as Omeprazole. Atorvastatin. Kevin presented Lovastatin. Okay. This is another pregnancy X category because it's a statin. Okay. This I'd like to, oh, yours is a D. I'm sorry. Which is very close to X, okay? So statins can either be D or X then, okay? For Lovastatin, for Kevin, it was an X. For you, it was a D. So do not give to pregnant women. And then another thing I'd like to point out is it may take up to 2 weeks before cholesterol levels improve. This is general, okay? This is usually the general effect of drugs, except for those immediate acting drugs. Antidepressants. You should not stop antidepressants before day 14 because you will not see the effects yet until after 2 weeks. That's why the doctor, the pharmacist should counsel and say that do not stop this medication. You won't see the effect until after 2 weeks. This is very, very much alike. This is the same, okay? It may take up to 2 weeks before you see cholesterol levels improve. And another thing, when you're on a cholesterol maintenance or cholesterol lowering drug, very important point that just mentioned is you cannot be on this medication and then eat what you want, not do anything. It's always in combination with diet, exercise, and weight control. Okay, always, always. I always say everything in moderation. Yeah? Can I have this? Can I eat this? Everything in moderation. Okay? Everything in moderation. Okay. Next one would be mine, whatever we didn't cover. Let me pull it up. Hi, Miss Jaylene. I'm just going to continue.
Hi guys, thanks for letting me interrupt.
Yeah.
I'm on campus today, so I have a mask on.
Oh, that's fine. Okay. Yeah, Ziri, you may go. Just go, okay? No problem. Okay, next one. I have Imodium. I tried to pick up most of the over-the-counter drugs, okay? Imodium, if you don't know, a lot of you know that this is for diarrhea. Antidiarrheals, loperamide, okay? Treats diarrhea. It can be prescription and it can be OTC, okay? Miss Jaylene, do you know why sometimes this is in the pharmacy, not outside?
No, I don't know why. How come?
Okay, I had a student who told me that Imodium is usually, this was in the past, okay, stolen That's why in Walmart pharmacies,
Oh,
that's
it's
why
stolen.
stolen.
Wow.
Stolen. That's why they put it. That's why they put it behind the counter already. Okay, so loperamide, brand name Imodium. This will be fast because a lot of this are over the counter drugs. So this is your anti-diarrhea for Imodium. What else have we not done? Lanoxin. You've had this prescription many times during this week and the last week. Lanoxin. So you should know a lot of information about this. The generic is digoxin. Okay. It came from a plant. I want you to take note of this because it may come up on the test, final exam, or national certification exam, from the plant called digitalis. Digitalis. Okay. So history, in the past, of course, all of our drugs come from natural sources, either plants or animals. It can come from the roots, the leaves, the bark, the fruit itself. Okay. Okay. We make elixirs out of that and we get the sap, stuff like that. That's why while I was in pharmacy school, we had a class called pharmacology and botany. Okay. Which we studied plants, and I told you that my thesis back in pharmacy school is we used a plant and created a drug out of it in comparison to an acetaminophen, how effective it is at lowering fever. So it can also come from animals. Sometimes it's the scrotum of animals, the urine of animals, okay? Like Premarin. Premarin is a drug that came from pregnant mare urine, a female pregnant horse's urine.
Now I could never take that.
And you're not supposed to take that. Okay, so history, of course, we get them from natural sources. Now we have synthetic drugs, okay, in combination with natural ones. So this is the one that still came from a natural source, which is digitalis, the digitalis plant, okay. Anti-dysrhythmic, dysrhythmia, arrhythmia, irregular heart rate, irregular heartbeat, okay. We talked about this. What is fast?
Tachycardia.
Tachy, T-A-C-H-Y, tachy, came from the word, like, if you want to remember it, tachometer, which is speedometer. Tachometer is more commonly used in Europe, okay? Versus us, we use speedometer, okay? It tells you the speed. So tachometer is, tachycardia is fast. What's low?
Bradycardia.
Brady, okay? I don't want to get into football, but Brady, Tom Brady is not slow, I could say, okay? Not a fan of football, but you cannot associate the two because it's...
Comparatively to everyone else, he is. But he's not to the average people.
Well, we're old people, come on! But for our age, we're fast. We're really fast.
No, I just meant compared to everybody else in the league. He's just, that's why he's...
Okay, I thought you were saying he's slow, but anyway,
no.
You gotta love this old athletes, yeah? Anyway, going back, so digoxin came from the digitalis plant, anti-dysrhythmic, arrhythmia, irregular heart rate, irregular heartbeat, fast is tachy, slow is Brady, B-R-A-D-Y, okay? What else? It treats heart failure and atrial fib. Okay, let me go fast. Ms. Jaylene, we're going to finish fast. We're trying to target 11:30 because I have meetings. Okay, I talked about this many times, right? Loratadine and desloratadine. Tadine versus tidine. Okay, loratadine, let me write. Annotate. I did this in the last session too. You remember? Let me quiz you. Tadine suffix right here is for what?
Antihistamine, H1.
What kind? H1 you said. Very good. Okay. So H1, again, let me review. H1 is for what? H1 receptors. H1 is responsible for?
Allergies.
Allergies, that's why I wrote it this way. Remember that? H2 is responsible for? Anyone? Acid, very good. Stomach acid. So if you say H1 blocker, it blocks the culprit for allergies. If you say H2 blocker, it blocks the production or overproduction of stomach acid. So H1 versus H2 blocker is also called antagonist. Okay, so this one, the suffix tadine is for, you said H1, which is allergies. If we are going to think of an example of an H2 suffix would be tidine. The thing that comes to mind is ranitidine. Ranitidine, ranitidine, that's for stomach acid. You see how it can be confusing real fast? But if you write it this way, H1 allergies, H2 acid, loratadine, popular brand name Claritin, tadine, H1 allergies, ranitidine, tidine, H2 acid. It's an antacid. Is that clear? I cannot highlight this enough, okay? I do this over and over and over. Okay, next one. Let me see if we missed something else. Lovastatin was presented. Maalox was presented. Okay, meclizine. This is the last one. Antivert. Okay, popular brand name is Antivert because it's used for vertigo. Okay, what is meclizine used for? Usually motion sickness. When you're in a cruise ship or before it's over the counter, you can get this if you know that you have motion sickness. You're gonna get on a plane, you're gonna get on a boat, okay? You might want to grab this over the counter drug meclizine. Okay, the brand name is associated with Antivert because vertigo. Okay, I have vertigo. These are some of the things I mentioned to you guys. Okay, I had vertigo at 27 and it was gone for 10 something years, and then I had it back after 10 years, and it's hard when you travel because you throw up. So what I do, when you get older, it gets worse. So what I do, there was a period in time when I was diagnosed with vertigo when I was 27, I stopped flying. Okay, for a year, I was on medication for a year. And then for 10 years, I didn't have it until I went to this eye doctor that gave me the wrong prescription glasses. And I went through the tunnel on McCarran. Yeah, it was like so crazy. And I think that triggered my vertigo again. And then after that, I had bouts of vertigo. For some people, it's mild. For me, it's mild, except when I'm in an airplane. But for some people, it's worse. Okay, what's vertigo? Well, that's the feeling of dizziness. For them, the way they describe it, for those who had it worse, is the room is spinning. There was only one attack that I had where the room was really, really, really spinning so bad. And then you're throwing up, okay? Because I know that I have vertigo, before I get on a plane, I take either meclizine, Dramamine, or diphenhydramine, okay? But if I'm with my son, I don't take diphenhydramine just so, but it doesn't make me sleep though. So I still could, okay? But these are things that you can take, meclizine or Dramamine, okay? So what happens, I always have my throw up bag ready. Yeah, in the last couple of trips I didn't throw up, except for this one where I came from London and it was Virgin Atlantic. They couldn't land the plane because there's air traffic. Okay, so we went around. We were already at the airport. We went around for 1 hour, and I thought, oh, I made it without throwing up. And that 1 hour of just circling around the airport made me feel so sick, and I was throwing up. I'm home, but not home. Yeah, so that was worse. So this treats, not treats, but helps with vertigo. Okay, it's an antiemetic. Antiemetic means emesis is nausea and vomiting. The feeling of being nauseous and vomiting. So antiemetic is to stop that feeling of being nauseous and vomiting. Okay, so that's done. Last one, yay! I'm not gonna send you a break, so we're done. Abbreviations, let's do abbreviations real fast. Let me pull up my abbreviations and then I'll let you go so that I can be in a meeting. We missed you during lab, Miss Jaylene. I recorded though.
Oh, yes, I'd love to see it. You know, I just didn't gauge my time well. I went to go visit students and then I forgot I had a in-service. Anyway,
Okay.
I apologize. I missed it.
Yeah, that's fine. We'll have other lab classes, but I did record for you. Just
I'd
so
love to see it. Yeah, send it
yeah,
over.
send me the link. Okay, hang on 1 second. Let me pull up our drug words. Abbreviation, I mean. Sequence 2. Okay, we're on week 3. Okay. How do you abbreviate milliequivalents, which is another unit or measure of a drug's strength or dose? Kevin.
MEQ,
No?
milli equivalents.
You just say the capital and the lowercase.
Oh,
Be more specific.
is it capital M, lowercase e, Q? No.
You flip-flop, okay? You flip-flop. Because milli is a prefix and it's lowercase like milligram. That's a lower M, okay? So Adziri, help? Milli equivalent?
It's not the M capital E or lowercase m capital E lowercase q.
Okay, take note. It's lowercase m, capital E, lowercase q, okay? RDS, all caps. Nicole, what does it mean?
Respiratory distress syndrome.
Respiratory distress syndrome. So what's ARDS, Tony?
Adult respiratory distress syndrome.
Correct. What's PF? Both caps, Kevin.
Peak flow.
Peak flow, very good. You don't have to capitalize the P or the F, okay? But since it's both capital on the test, I want you to put capital, okay? I know morning is AM. It says there on your packet, capital A, capital M. It can be A dot M dot, it can be lowercase AM. It can be A dot M dot lowercase. All of those are acceptable. Okay, so that's morning. And then your PM is the same, capital PM, P dot M dot, lowercase PM, lowercase P dot M, lowercase M dot. Okay, SOB, I'm not calling
I
you
know
an
this
SOB.
one.
Robert, I'm not calling you an SOB, but in medical terms, what's SOB?
Shortness of breath.
Shortness of breath. Good job. Shortness of breath. Solution. How do you abbreviate solution, Jess?
Capital S, lowercase OL, period.
Okay. Yeah, it can also be abbreviated as lowercase SOL, period. Okay. During my time, SOLN, period, is also an acceptable one. But for your test, SOL, period, is what's acceptable. Okay. Here we go. MDI. I wish I have an MDI here. I'll show you when we're at the lab. Okay. MDI, Eileen.
Meter dose inhaler.
Meter dose inhaler. Those who have asthma. I don't think Kevin has one. Do you carry one? Okay, not anymore. So meter dose inhaler. It's called
I have a box.
Oh, there you go.
Just a box,
Perfect.
though.
Okay,
That's
thank
the
you.
inside.
Thank you, Miss Jaylene. Okay, meter dose inhaler. It's called meter dose inhaler for a reason. One, it's an inhaler, okay, for asthma. Two, okay, it's metered every spray. It's metered. That's why meter dose. As long as you do the full spray. Okay. What did I say? What do you have to remember when you're given a meter dose inhaler? First thing that you should do, Tony, you remember?
Shake it.
Good job. Shake it. It's like Family Feud. Okay, you are. I said Family Feud because my son is into watching all of this funny compilations of Family Feud, like stupid answers, or it's already up there. Anyway, so he's got me into watching that as our break time. SVN, Jess, SVN.
Small volume nebulizer.
small volume nebulizer. It's also used for breathing for asthma. Okay. We'll talk about that once we get to pharmacology. And then URI, Eileen, URI.
Upper respiratory tract infection.
Take note, huh? It doesn't have a T. Upper respiratory tract infection, URI. Okay, all caps. It has to be all caps. So the U on the upper has to be capitalized. The R has to be capitalized on respiratory. The tract has to be capitalized on the T, and then the infection. So some reminders. Monday, you don't go to the campus. We do review of pharmacology, pharmacy tech duties finals. Tuesday, you have 3 tests. What are those 3 tests, Kevin?
We have the drug words quiz, then the abbreviations quiz, and then our final for.
Very good. We have finals for pharmacy tech duties. We have drug words week 3. We have abbreviation week 3 quizzes. So you're going to have a busy Tuesday. I'm going to be working in the background. I will have a meeting with Miss Jaylene and the rest of the team at 2 o'clock. I have another meeting at 12. Okay. So I will tell you, make an announcement as to when the next lab class is after I've discussed this with Miss Trisha. How she is, and I'll give you a heads up. She'll be back the 21st. Okay. Happy Friday. And remember, positivity is a choice. Like what I said, I don't like wearing shirts, but here I am wearing a shirt. Okay. Enjoy your weekend. You should have done all of your audio lectures. Okay. Start reviewing for the finals. When I review you on Monday, I'm going to have a digital whiteboard. Okay. You're going to have to answer, and that's going to be part of your grade. Okay. Which means you should be ready by Monday for final exam. Okay. I'm going to have little whiteboards for you guys. Okay. And you'll put your answers in there. It's not going to be a Kahoot this time. Okay. I'll see you guys Monday at 10 a.m. Bye. Miss Jaylene, I'll see you too.